Good afternoon. I'm Dr. Bonnie Henry, the Provincial Health Officer for British Columbia, and this is our COVID-19 update for today, the first day of October 2020. I want to start by acknowledging that I'm speaking to you today from the territories of the Lekwungen-speaking peoples, the Songhees and Esquimalt First Nation, and we're very grateful for the traditional keepers of this land. Today we have 82 new COVID-19 cases identified, including one which is epidemiologically linked, giving us a total of 9,220 people diagnosed with COVID-19 in British Columbia. That includes 3,360 people in the Vancouver Coastal Health Region, 4,712 people in the Fraser Health Region, 209 people in the Vancouver Island Health Region, 535 people in the Interior Health Region, 317 people in Northern Health, and 87 people who generally reside outside of Canada. We are now up to 1,261 active cases in the province in all health authorities, of whom 69 are in hospital, 19 of whom are in critical care or ICU. And that includes 29 people who are in hospital in the Vancouver Coastal Region, 36 in Fraser Health, 2 in the Interior and 2 in Northern Health. We have sadly one more death to report in the Fraser Health Region, bringing our total number of people who've died from COVID-19 to 235. And our condolences and our thoughts go to this person's family and their care team. And their community, who I know are mourning their loss. We have 3,093 people right now under active public health monitoring and 7,695 people who have recovered from COVID-19. I did want to note that we did a record number of tests yesterday, over 10,899 to be exact, for the 82 positive ones that were determined. And I think that's just an incredible feat as our lab has been ramping up, our laboratories have been ramping up across the province. And I know there's been some challenges in some places, but this really speaks to the amazing work that people are doing across the province to make sure that we can get people the testing they need as quickly as possible. We have one additional healthcare outbreak at the George Derby Centre long-term care home in the Fraser Health Region, and unfortunately this is a recurrence, a second outbreak in this facility. It was a single healthcare worker, so we're hopeful, and Fraser is on site working with the team to manage this outbreak. We have 18 active outbreaks now in the healthcare system, 15 in long-term care and 3 in acute care units. And 860 people in the long-term care have been affected, including 513 residents and 347 staff. We have no new community outbreaks to report today, although we continue to have exposure events which are posted on Health Authority and the BC-CDC websites. And as we know, school exposure events are being posted as well on all Health Authority and BC-CDC websites, and people are encouraged to look at those as well. I would like to start off today talking about schools. I know that there is a lot of concern and anxiety still around schools, and I know this is because we all want everybody in our school settings, particularly our children, the educators, and all staff in our schools to be safe. And we have, as you know, developed COVID safety plans for each school. Each school has a COVID plan and is liaising with their public health school health officer all across the province. Like other aspects of our COVID BC response, we are doing our best and adjusting as we learn. And I think it's important to recognize that we don't always get it right off. And when we started sharing information about school exposures, our communications across the province were not fully aligned, and what was being said in one place was not always the same as what we're doing or what was said in other places. And we are working through those kinks and continue to refine our approach. And I am confident now that our communication approach is aligned in all health authorities across the province. I know this has created some concern, and I just want to say that from the very beginning it has been clear, and the most important thing that we have focused on in public health is that our public health teams have been there and done contact tracing and response for every single case that has been identified in any school when there's been an exposure, and in any person in the province who has been identified as having COVID-19. Sometimes there are teachers or school-age children who have been identified who've not been in the school during their infectious period, and so those are not exposure events that we would notify in terms of the school. But I have been closely monitoring the contact tracing work that our public health teams are doing. And I am confident it is working and working well. And we know that because we are able to manage and determine every single exposure event, whether there has been transmission in the school setting, who has been close contacts, and making sure that those people have been isolated so that we break those chains of transmission. They're not able, if they get sick, to pass it on to others. Our public health teams are on the ground identifying every new case and following the processes that we have to notify and alert the school community of every potential exposure. And I want to provide a little bit more information on school exposures and clusters and outbreak and what we do with these. This is in keeping with what we do for other communicable disease events that we see in school and have historically. And of course, we've modified our outbreaks, our protocols, the exposure events, so that we can adjust to this pandemic. So a school exposure is when a single person is confirmed positive for COVID-19, has been in the school during their infectious period. So that's a common definition that all of us are using around the province. Many of the health authorities are also determining when a cluster, if that would be 2 or more people who are confirmed positive, attended school. But every time there is a school exposure, public health contact tracing kicks into gear. There are things that contact tracers do that are a skilled set that we have developed and we're very good at. We've done it for years, and we now have developed the skills that we know to understand what type of contact puts somebody at risk of being exposed to this virus, COVID-19. So we identify who is a close contact and who isn't. So even if you have been in a school setting with somebody, you may not be a close contact. You may not be at risk of exposure yourself. Anybody who did have contact where the virus could have been transmitted has been contacted by public health, and we know that's working, and we've seen it in schools across the province. And the role that we play, we know that if somebody has been exposed to this virus, there's nothing we can do to prevent them from getting sick if they've been unfortunate enough to be exposed to a large enough dose of the virus. So what we need to do is keep them out of the school, out of contact with others during that incubation period, which can be up to 14 days from their last contact, and making sure that they have what they need to stay away from others in case they develop symptoms. If they develop symptoms, then we can be sure that they're not going to be transmitting it to others. So if people don't have close contact, what we ask them to do is to monitor. And it's the things that we have in place in our schools, all schools, to make sure that people are monitoring carefully, that we stay away if we're sick, and that we keep those distances when it's appropriate, wearing masks when it's appropriate. An outbreak in a school setting is when we have ongoing transmission and we're not clear who has been transmitting to who. And there's widespread transmission in a school or in between groups of classes or learning groups. We have not had any outbreaks in our schools yet in British Columbia. It is a possibility. We have seen it happen in other places, and we will be watching for that. But we do know our system is working because we are finding cases, we are finding smaller transmission events, and we're isolating people and preventing outbreaks from happening. Our contact tracers investigate when the person, where the person who was infectious, whether it's a child, a teacher, a bus driver, our custodial staff are doing amazing work around the province. where they went, who they spent time with, what barriers were in place, the types of activities they did, whether they were wearing masks. All of those things are really important for helping us determine whether somebody had the potential to transmit this virus to somebody else. It's a highly skilled job that requires specific expertise, and our public health teams are really good at it. And they will sometimes talk to the teacher, they'll talk to other people in the school to try and understand better the circumstances around exposures. And as we've said, only close contacts or people who are at risk will be notified by public health. So let me provide an example. And these are types of situations that we are seeing happen now. A parent contracts the virus and passes it on to a child without realizing it. And we know that many people can have mild symptoms. And so before the parent recognizes that they're ill, they may have passed it on inadvertently to their child, who may also have very mild symptoms or no symptoms at all. And the child has no clear indicators of illness, goes to school. Perhaps he also hangs out with some friends after school, or goes to another group setting, whether it's after school care, or whether it's playing on a sports team, or hanging out with a group while they're infectious. Then the child develops symptoms, or the parent gets tested and the child is recognized as being at risk and it gets tested, and public health is alerted when we have that test. Contact tracing then determines who is the people that they hung out with, who are the other family members that are at risk, who is the people who the person spent time with outside of the school setting, and what happened in the school setting. And from there, people are notified and are required to self-isolate. So there is many situations where students may have had contact outside of a school setting and may be required to be isolated and may develop symptoms and have COVID themselves. But the important thing is that we're managing the school environment to prevent transmission and ongoing movement of the virus within the school. And that is the chain of transmission. That's what we do to stop every day. And we do that by making sure people who are at risk are away from others during that incubation period. It's also why it's so important to use the layers of protection and really pay attention to how you and your family are feeling, and stay home if you're feeling sick. It's also why it's so important to reduce those contacts outside of the school setting, where you might have other groups coming together and you might be exposed to risk. So our understanding of COVID-19 has grown. What we're able to do safely here in BC is also grown. It's much larger than it was in March and April. By staying small and staying safe, we've been able to expand those activities that we can do in our community that are important for our entire community wellness. Today, many businesses are fully operating, children are in school, as we've talked about, stores are open, but they all have COVID safety plans, and those plans are what protect people and what protect all of us. So we all need to continue to do our bit to make sure that we are keeping our distances, that we're wearing masks when that's not possible. And if somebody tests positive, public health will work to make sure that we remove anybody who's at risk from those situations where they can pass it on to others. The other important things, of course, are washing our hands, maintaining our safe physical distance, using a mask when needed, and always staying home when we're ill. Those are things that across our community will allow us to continue to have our schools functioning, to continue to have our businesses growing, to continue to have our small, safe social gatherings. That safe circle is what it is now because of everything that people in BC have been doing. And we've been doing our part to keep our community safe, and we want to keep it that way. But we have to keep working on it. We are on the right track, and I know we all want to keep going. We're learning to live with this virus to minimize its impact on our communities so that we can do all those other important things as well. It's important we continue to keep our groups small, particularly our social groups right now. Stick to our safe six, minimize travel, and keep our safety basics top of mind. By supporting each other to do the right thing, and offering kindness to each other, supporting each other to care for our friends, our neighbors. That's how we protect our communities, and that's what we have been doing and doing successfully here in BC. We need to continue to do this and to continue to care for each other and support each other and be kind and be calm, and that's how we will keep each other safe. Thank you, and I'm happy to take questions.
Thank you, Dr. Henry. As a reminder to everybody on the phone, please press *1 to enter the queue. You are limited to one question and one follow-up. I would also ask that you please take your phones off mute. You will not be audible until your name is called. First question is from David Moko, CTV.
Appreciate your acknowledgement of a work in progress here. I wanted to ask you about asymptomatic testing. I do understand your position on whether this is useful, but for example, travelers who need proof of a negative COVID-19 test for international travel, that may be essential. The film industry has its own guidelines. We're hearing stories of a significant backlog in processing time by Life Labs. What was 48 hours is now 7+ days. Obviously, the priority is tests for those with symptoms. But my question is, should we be relying so heavily on one private processor? What's to say this isn't going to keep happening again and again, even once we catch up?
Yeah, the priority is, of course, to make sure that we can identify cases that may lead to transmission in our community, and that's what we have been focusing on. And Life Labs is an important part of our system here in British Columbia for that public priority. Life Labs had been using some of their capacity to support private testing for asymptomatic people for the reasons you say. They have had some challenges in keeping up with our needs in the public system and being able to support that as well. And I know they and our lab system are working on how we can do that better to support people who absolutely need to have, particularly people who need to travel or have medical procedures in other places done. There's a number of a small number, but people who need a test. And yes, we are working on making that more available for people.
David, do you have a follow-up?
Yeah, just following up on the transmission question, I want to check in with you on this. Can you give us an update on where transmission is happening? It was, late night in bars and restaurants, and then we saw that health order, social settings in people's homes. I remember your comment, just because your backyard can fit 50 doesn't mean you should. What does it look like now in the last week or so?
Yeah, I haven't had the detailed update, but when I look at the clusters, we're still dealing, and as you know, with people who are testing positive today are people who have been exposed over the last week to 2 weeks. And so we're still seeing some of the effects, but we are seeing social gatherings still being an important part, maybe a third of the cases that we continue to see. But these are social gatherings in different settings now, so mostly private homes where people are inadvertently bringing it in. We have seen, as you know, some settings like workplaces, the long-term care homes, unfortunately, and some of our hospitals. But we're now seeing smaller clusters, and we're seeing our numbers level off. So the number of people a single person will transmit to has gone down, which is good news for us, and it means that people are doing the things that we need them to do. And I will have some more details about that next week. I'm going to be presenting some more data on our regular update next week.
Next question is from Mary Griffin, Check News.
Oh, hi, Dr. Henry. Thanks very much for taking my question. And I know you addressed this on Monday, but it has to do with Halloween. You said that you were taking a look at national guidelines and how families can participate in Halloween. And we spoke with people today who said they are going to go out with their children. I'm just wondering if you have any follow-up on that.
Yes, we are working on some guidance for a couple of things. So Halloween is one of them. I know that it is of particular interest for some a good number of people, and we'll be looking at things like pumpkin patches and haunted houses and guidance on how to do it. I think the basics, though, will be the same, keeping it small and recognizing that there are many people in our community right now who don't want somebody coming to their house in Halloween. So traditional neighborhoods that might usually have done a lot of trick-or-treating or having communities get together, I'm hearing from some people they're very concerned about that this year, particularly if there's a lot of elderly people in the community. So we need to recognize that it is going to be a different Halloween this year. We need to scale it back, keep our numbers small, but within those parameters, we can do some things that will be fun for people, and we'll have our guidance is being finalized. It should be posted very soon. The other things that I'm hearing about and that we're working on some guidance around as well are November 11th ceremonies, very important for us, how to do that safely. People have been asking about as far away as Christmas, but Thanksgiving, and we've talked again about the importance of keeping things small this year and including and reaching out to family members and friends in a virtual way to support each other through this very trying time. These types of celebrations and ceremonies and Thanksgiving, the days of remembrance, these are important for us to maintain our social connections, but we have to do it differently this year. And it won't be forever, but for this year, we need to think small. We need to think our nuclear family, our close contact group, and we need to look at how we can find those innovative ways to include our broader community, to support each other in the broader community in ways that don't put people at risk. So we'll be coming out with more detailed guidance I'm hoping by early next week, mid next week, around a number of the important events that are coming up.
Do you have a follow-up, Mary?
I do. Just touching on that, you just mentioned haunted houses and that sort of thing. A lot of those events are outside. So would you expect that as many of the events that have been held on Halloween, such as trick-or-treating in a business district or community bonfires or haunted houses, those are likely to be off the table this year just in favor of those small groups?
Well, I think you probably answered your own question. Yes, we need to think about this year doing things differently. There is still absolute limits on people, and that's 50, but many of these, 50 is too many. So let's look at making it a special, different Halloween, keeping it small, and making sure that we respect that some communities may not be wanting to participate this year.
Keith Baldry, Global News.
Oh, hi, Dr. Henry. Thanks for this. Just wanted going back to the tests. We're testing, obviously, many more people than we were in the past, but in the last 2 days, I guess 20,000 people tested negative. How much of a challenge is it to inform these people? I mean, I don't know. Do you have the capacity, the resources to inform 20,000 people in a short period of time that they tested negative? How does that work?
How do you know these things? No, it's obviously this has been some of our challenge. What I am confident in is when a positive test comes up, we are on that very quickly within 24 hours and the person is identified. This is something that we've been following for some time. We have had some challenges in some parts of the province with getting the negative test results out in a timely way. It has waxed and waned depending on the systems. And this is really because we have several different lab platforms, that means the types of the machines in different parts of the province, as well as several different lab networks. So Life Labs, as you know, is a private lab network, and the IT systems sometimes have a challenge talking to each other. We are absolutely working on that to streamline it, and we're coming up with ways that we can try and do both the front end and the back end more efficiently, particularly for people who are negative, because we recognize how much that can interfere with your ability to get back to school or work. So that is a concern that we're working on.
Do you have a follow-up, Keith?
Yes, on schools, again, I appreciate your clarifying exposures versus outbreaks versus clusters and such. There is a school, I'm just noticing people contact me on Twitter, that there's an elementary school in West Vancouver, Caulfield Elementary, I think, which has a number, something like 15 kids have tested positive in a grade 2 class, I believe. Is that an outbreak or is that a cluster?
Yeah, so I don't know all of the details, but what I do know is we have no outbreaks. So there's not been widespread transmission in a school environment. And what I do know is in many of these situations, there may be one or two, there may be a transmission between one or two students or a teacher and a student or other such situations. But once public health has identified people and pulled out the people who are close contacts, and in some cases that means the whole classroom will be asked to go home and self-isolate, and those are people who've been exposed. So it is likely that some of them will develop illness in that incubation period, but they are not in the school setting when they get ill. So it's not an outbreak. There are no outbreaks across the province right now, but that tells us that our system is working, that we're identifying people and we're stopping those transmissions. We're making sure that anybody who's a close contact in those settings is self-isolating through the incubation period.
Next question is from Brishti Basu, Victoria Buzz.
Hi, Dr. Henry. Thanks for taking my question. Are you at all concerned that, depending on the outcome of the provincial election, the steps and orders that you've issued to provide a safe supply of drugs to replace the toxic street drug supply may be reversed?
No, those orders are public health orders, and that is part of my responsibility under the Public Health Act. So those are orders that I do independent. Obviously, it helps when government is aligned, and we have started the process. There was a ministerial directive as well to change the regulations under the Regulated Health Professions Act to allow this to go on long term, and I would hope that would continue, but my orders would still stand.
Do you have a follow-up, Brishti?
No, that's all. Thank you.
Thank you. Next question is from Marcella Bernardo, News 1130.
Hi, Dr. Henry. Thanks again for taking our questions today. You mentioned that we have a record number of tests done over the past 24 hours, and just wondering if you could elaborate on what is needed now as far as trying to get that process sooner when we're seeing the a lack of reagents or the physical stuff that is needed in order for people to do that work properly so that people can get tested.
Yeah, I will also say, just because you brought that up again, our percent positive is actually staying very low, and today it was less than 1% of the tests were positive. So that tells us that we're doing a good job at finding people, and that this is a true sort of leveling off of our cases. There are many things that we're doing. So we think of laboratory testing in the appointment and getting the test done. There's what we call the pre-analytical, or accessioning, which is the fancy lab term for, it comes into the lab, they make sure there's a name and an identification that goes with each specimen. Looking at ways that we can speed that up. There's ways that we can speed up the process of how the sample is extracted. There's several processes several steps in that process, so that's the analytical phase. Some of those take more reagent than others. There's ways of pooling samples so that we can put 4 samples in a single test at run, and because our rates are really low, and that's one of the reasons I mention it, that increases our efficiency because most of them will be negative, and then if one pool tests positive, we go back and test each individual sample from those pools to see who was the positive person. So those are things that we're looking at. And then on the back end, as I mentioned, looking at linking our IT systems so that particularly the negatives, the positives we're pretty good at, but making sure that the vast number of negative tests get reported out in a more efficient way. And that could mean automatic texts or emails to people. It could mean automatic downloading onto the eHealth website so you can go and check yourself within a period of time. And so those are all things we're considering along the whole spectrum of the testing protocol or the testing process. Some of the other things we're looking at as well are the ways that we can reduce the number of people who have to go in to get a nasopharyngeal swab, and we've talked about the gargle and spit test. We hope to have more of the test tubes available sooner so that people who have a hard time with the nasopharyngeal swab or others can access them through more places and do those at home and drop them off at a lab to make that process faster as well.
Marcella, do you have a follow-up?
I did regarding, you touched on this a bit about your public safety orders or the orders that are in place right now. Have you given any more thought to the regionalization question, where we're hearing from people in the interior and other parts of the province who are saying our case count is low, why do we have to follow the same rules that everybody else does?
Yeah, you know what? Our case counts are low, but those are the people we know about, and the risk is the same, and we've seen that across the province where things pop up all over the place. So the settings where risk is highest are the settings where we have orders, and we have very few compared to many other places. And it really is risk all around us that we need to be aware of as well. And we're seeing increased numbers of cases in Ontario, Quebec, as you know. There's still tremendous issues in Washington State. And this virus moves with people. So anytime people move, our risk comes with it. So we have focused on making sure we have the basics in place to minimize those risks. We know that it's transmitted through people in the community, so we can't get rid of that risk altogether. And certainly had hopes about that months ago, but that's not the case. So now we have to figure out, how do we live with this virus, minimize those transmission risks, so keeping numbers small, and that's where the order around 50 comes in, reducing those environments where transmission can happen, very much more high-risk transmission like the nightclubs and bars, and that is the same everywhere. And then having public health follow-up of every case to make sure that we can put out all those flames or sparks when they happen, no matter where in the province they are. So the orders that we have in place in BC are ones that address the risk that is the same everywhere.
Next question is from Rob Monroe, Info News.
Hi, Dr. Henry. My concern here is long-term care homes. And as you unlikely know, undoubtedly,
Rob, are you there? Okay, we will come. Rob? Okay, we're going to come back to Rob.
Hello?
Oh, we lost you. Can you start again?
I should. Sorry, can you hear me?
Yes, go ahead.
Yes, Dr. Henry. There was a rally in Victoria in the legislature, at the legislature yesterday from families of residents in long-term care homes who want the rules eased so more people can get in, especially essential visitors, but also social visitors. I know there's more outbreaks, and there's real concern about when this disease gets into long-term care homes. Is there any timeline of when they might see some movement there? Are you waiting till Isabel McKenzie's survey results come out at the end of October, or is there some chance there will be something happening sooner?
Yeah, no, I absolutely, and thank you for that, because this is something that that we have been paying a lot of attention to, and it is so challenging, partly because of the staffing issues that we know have been a problem over the years. We've started an initiative to increase staffing, and that is underway. There's been support to make sure we have people who can facilitate safe visits. And the other pieces that we have been really concerned about is making sure there's enough PPE, and we think we're in a good place for that to support visits. We also want to make sure that we don't have to walk things back, that we can do processes that will be in place that will be sustainable over time, and that's where we're focusing on now. We have defined essential visits much more broadly, and the work that is going on right now is a couple of things. One is to ensure that everybody is at least being able to have those regular visits with their family member, a single person, and then and to have some consistency in how that is being done in all of our facilities across the province. We also absolutely, and it's not on any time frame, I do absolutely want to hear what Isabel's McKenzie's survey shows us. We know that it has been a very challenging time for many, many families, and for our seniors and elders in care. and we want to do our best to try and make that as easy as possible for people. I do think we're looking at moving to at least having an alternate person, not more than one person at a time, but an alternate person. And we are just seized with the challenge that this virus is still circulating in our community, and the best we can do to suppress it in our community gives us that opportunity to increase the number of people we can have in our long-term care homes. It is something that is it's a really challenging and difficult thing.
Do you have a follow-up, Rob?
Yes, I do on that. And the concern I'm getting from people is that they're seeing their loved ones dramatically dwindle physically sometimes. They're not being fed properly. They're losing 10, 20 pounds and mentally deteriorating in quite a hurry. And a lot of these facilities don't seem to be very open to essential visitors. How do we assuage those people's fears that we're giving people alive just to die alone?
Yeah, I know. These are challenging things. And I know the sector, both the operators, the Ministry of Health is working with each individual home to make sure they have the staff that are needed to provide care to all residents. And this is the challenge we have. It's not just my individual person. If I bring it into a care home, and we've seen, unfortunately, this happen recently, it is the whole home that is at risk. So we have to find that balance. We are certainly working on that, and we're working on making sure there's appropriate staff to provide the care that's needed, to increase the care hours for people so that everybody gets what they need, and to have consistency in essential visitors being able to come in and support their people.
Next question is from Lynn Mitchell, Vancouver Sun.
Afternoon, Dr. Henry. This GeneTrack Biolabs, Vancouver-based, I believe, it's the only Canadian lab that has received U.S. FDA approval for COVID testing. Is that an option for the province to ramp up the testing with this company?
I have to say I'm not familiar with that company, so I can't answer that question, but we can get some information to you. I do know there's that our lab team is looking at all options, and I know there are some private laboratories that are looking at supporting some of the non-public testing, for example, with industries and travel-related required testing, things like that.
Do you have a follow-up, Lynn?
Yes. What is the backlog that we're looking at of testing right now?
We don't have a backlog of testing. We within a 24-hour period, all of the tests that have been submitted to the lab have been processed.
Next question is from Richard Zussman, Global News.
Dr. Henry, from September 10th to September 30th, children under 10 saw a 67% increase in confirmed cases, 120 more kids. Youth between 10 to 19 saw a 47% increase, 168 more cases. With these numbers going up, is the move to make protocol more lax in schools, or the definition changing around outbreaks, does that still make sense to you?
Absolutely. So we need to put this in perspective. Those numbers are increased. The testing that we've been doing in that age group has also dramatically increased. And still children in both those age groups are underrepresented compared to the proportion they are in the population. And I'll present some of that again with our updated numbers next week. But we still see that there are very few relative to, the population of about 10% of our population are children under the age of 10, and the numbers of cases in that group are less than 3%, less than 1%. We have had, and we've ramped up our testing quite dramatically, and the percentage percent positive in the testing is actually very low. So I will have the exact numbers for you next week when we do that. But we also have to put that in perspective with, we've done over 35,000 tests in people under the age of 19, and very few of them are positive. And we've looked at what are the symptoms for those who test positive. And a runny nose by itself, which anybody who has children knows is a very common symptom during the winter months, and that is not associated with COVID by itself very frequently. So those are the types of things that went into our thinking. The screening protocols that we have for can my child go to school today are based on that. Parents know their children, and they know that sometimes they have a runny nose that can go on for some time. They know that sometimes they'll wake up and feel a little bit off today, and that may mean that they stay home for 24 hours and you see how things go, but then they can go back to school without requiring a test. So those are the trade-offs that we have made, recognizing that it's still very low in young people and school-age children in our province, and that's good, and that we have those measures in place in our schools to detect anybody who does have the disease. So it is a balancing, and it reflects the risk and the risk assessment that a parent has to do with their child every day, and the fact that they know as well when their child is sick.
Do you have a follow-up, Richard?
Have you heard concerns from parents about the rising number of cases amongst young people? And are you going to have an opportunity to meet with BCTF President Terry Mooring? I know that she's recently sent you a letter asking for a meeting.
I have not received a letter from the BCTF, but I'm certainly open to meeting with them, absolutely.
Next question is from Lisa Cordasco, CHLY.
Thank you. I just wanted to go back to the question about life labs. Did I understand correctly? Can you confirm that test results are, in some cases, taking 4 or more days?
Negative test results. So positive test results have all been sent and to public health and to the ordering clinician, and people have been notified within 24 hours. That is our standard. Negative test results have sometimes, in some cases, taken several days, we've heard.
Lisa, do you have a follow-up?
Yes, thank you for that clarification, by the way. You mentioned earlier that we're seeing a leveling off of cases in BC. Are you saying that the province is now bending the curve, as opposed to the situation in Quebec, which is being described as a second wave?
You would know that I'm not one that overstates positive things. I'm cautiously optimistic. We're looking at the numbers. I follow the modeling on an ongoing basis, as you know, and I'll be presenting that next week. But we are not seeing that exponential increase. We've been having a linear increase, and it's kind of slowed down. We still have numbers that are, reflect the fact that there's ongoing transmission in the community that we need to be aware of, and we need to be careful. We've found with this virus, and I say this with all humility, it sneaks up on us, and we can have explosive outbreaks if we're not on our guard.
Jennifer Yang, Toronto Star.
Hi, Dr. Henry. Thank you for taking my question. I'm calling you today from Toronto, Ontario, where we've just changed screening guidelines for schools. And I'm really interested to know more about BC's experience, since you've gone through some of this calling of symptoms from the screening list sort of earlier than we have here. You said earlier that runny noses alone are not associated with COVID by itself very frequently. Do you have statistics on or any data on how often you see runny nose as a single symptom in COVID-positive cases in kids, or as one of several symptoms in COVID-positive cases in kids?
Yeah, we have some of that data, and it's mostly presented on our BC CDC website, so I'd encourage you to look at some of the stats up there. But I think what we have to recognize is it's a risk, relative risk. So it's not only, how many kids who test positive, runny nose is the only symptom, but it's how many kids who have a runny nose only who test negative that give you an idea of how predictive runny nose by itself is for somebody to have COVID versus the many other things that can cause a child to have those symptoms. So those are the assessments that we've been doing around all of the symptoms, and we're not alone. Quebec has been doing that as well based on their experience, both with schools that went back in June as we did, plus daycares, and we've been looking at that. The Yukon has some good data. We've been looking at data from schools around the world and from symptoms in young people around the world. So there's quite a lot of good data that helps us understand those things now.
Jennifer, do you have a follow-up?
So yes, I do. I understand Ontario said today, I think Dr. Yaffe mentioned that she had consulted with BC in changing Ontario's guidelines. Could you tell us a little bit more about that consultation process and what was discussed?
Yeah, so as we've talked about many times, we have a special advisory committee. That's a national committee where the chief medical officers of health, my counterparts, and Dave Williams and Barbara Yaffe, Dr. Yaffe, are part of that committee. And we exchange information about all of the things that we're doing in each of the provinces and territories and the Public Health Agency as well. We also have a technical advisory committee that is made up of, similarly, experts from the Public Health Agency, from the lab, and from provinces and territories. And that is the forum that we share a lot of this information and data on. We have I would call it natural experiments across the country where we've done slightly different things in different provinces and territories, and I know that causes some concern for some people, but things like what are the probabilities you're going to have an outbreak if your mass gathering limit is 250 versus 50 versus saying that you can only have 10. Those are the things that we talk about. We talk about the how it's working with schools, what outbreaks we're having. There's some great information from Quebec that's as their schools went back earlier than ours about that. We talked as well about things like yield. How many positive tests do you get when you test certain groups, and what are the types of data? So I can't tell you exactly what we did have several discussions about this with our counterparts and talked about our rationale and why we're doing these things.
We have time for one more question this afternoon. For everyone listening, Dr. Henry will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For medical guidance on protecting families and communities and for access to provincial guidance on COVID-19, visit bccdc.ca. And for information about the province's pandemic supports, visit gov.bc.ca/COVID-19. Last question is from Ethan Sawyer, CBC.
Hi, Dr. Henry. If the cases at Caulfield Elementary are not considered an outbreak, are they still the first confirmed cases of in-class transmission in BC?
I can't comment on the specific school. There have been a few transmission events that I'm aware of, but none of them have been widespread or an outbreak.
Ethan, do you have a follow-up?
I do. Once children tested positive, why were parents and siblings not all tested right away? It is our understanding that at least 4 family members connected to the grade 2 class have also tested positive.
Yeah. Again, I can't tell you about a specific situation, but there's an assessment done with public health, and when people are isolated, they may not necessarily need to be tested, and we don't test asymptomatic people just who have had an exposure unless there's a reason. So there are different measures in place to ensure that anybody who has been exposed is self-isolating and staying away from others, and if they develop any symptoms or there's concerns, that they're tested. We do, the MHOs and the school health teams and our teams in long-term care, for example, there are some settings where we do much broader asymptomatic testing. So that's in a situation like an outbreak in a communal living setting, like a long-term care home, and where we know that residents can be infected and have very mild or no symptoms at all, and it can be so dangerous in those settings. So we do it in certain situations, and that's left up to the MHO, depending on the detailed information they know about every individual case.
That's all the time we have for today. Thank you.
Thank you very much.